Welcome. My name is Sam, your virtual nurse, and today we are going to discuss an important topic, post-stroke depression. Post-stroke depression, or PSD, is a common and serious complication that affects many stroke survivors and has significant impacts on their quality of life and overall health. It can also affect the mental health of family caregivers. In this presentation, we will review key factors of PSD, including the prevalence, complications, and causes. We will also discuss family considerations as they are a key stakeholder in stroke survivors' lives. Finally, we will discuss some treatment options that you might not have heard of before. According to most literature, around 30% of all stroke survivors experience depression in their post-stroke life. However, some scholars have claimed that number could be closer to 80%. Whatever the actual number is, it does not really matter. PSD is a serious complication that deserves attention. PSD onset can occur days or several years after a stroke. The causes are wide-ranged and complicated and include inflammation, brain structure changes, neurological dysfunction, and can be influenced by genetic makeup. The complications of PSD are serious and include worsening cognitive impairments, prevention or hindrance of physical recovery, increase in risk for subsequent strokes, diminished quality of life for patients and their families, and cost increases to patients and the entire healthcare system. The similarities between stroke effects and depression can lead to misdiagnosis and neglect in care, which is why it is important for providers to perform regular assessments. Family plays a crucial role in a stroke survivor's recovery. The stress and burnout experienced by family members can affect their ability to provide care and also diminish their own mental health. As it turns out, PSD can exacerbate these issues, but there is hope. A team of researchers looking to combat PSD and its negative effects on caregivers found that those that participated in a 10-week program, which included separate counselor meeting times for stroke patients and family members, were less depressed, had less burnout, and were more capable of fulfilling their caregiving and employment responsibilities. Families should strongly consider doing some form of this type of counseling, as it could help improve their quality of life as well as facilitate fresh ideas to stubborn care problems. Antidepressant medication is the most common form of PSD treatment. However, you might not be aware that there are some pretty cool alternatives that have been shown to effectively reduce depression in stroke patients. This list includes pharmacogenetics, repeated transcranial magnetic stimulation, and virtual reality. Pharmacogenetics is a promising and upcoming technology that can help match patients to the right medication. This is done by a simple and painless cheek swab and has been shown to reduce depression in people who have not had success with their current or former medication. It can also save the patient time and money. This low-risk option should be considered if a patient would like to try other types of antidepressants but don't want to deal with the long and sometimes dangerous process of antidepressant trial and error. Repeated transcranial magnetic stimulation, denoted as RTMS, is a system of treatment that delivers repetitive pulsed magnetic fields to induce neural activity in specific areas in the brain. The treatment is completely painless, and RTMS has been shown to significantly lower depression levels and can even help with neuropathic pain, which is a contributor of post-stroke depression. Virtual reality, or VR, is a computer-generated, realistic simulation system that allows users to safely interact within a human-made environment. VR's wide range of applications includes physical therapy and depression treatment, and can also be a fun way to explore alternative environments for those that have limited mobility. Family can also get in on the fun and even remotely interact with other users. And did you know that VR has been shown to effectively decrease stroke-related depression and can be customized to each person's individual needs? It may also be covered by Medicare, so ask your care team if you are interested in entering this fun and fascinating world of virtual reality. If you would like to learn more about these treatment options, please click on the link at the end of the video or find them in the description below. Thank you.